Hi, in this lecture, we're going to wrap up our study of nervous tissue by looking at some clinical applications. And the first thing is something you may have heard of before called neuromodulation or neurostimulation. And what it is using either pharmacological or some sort of implantable device that can act directly on a nerve. Now, we talked about the pharmacological ones already when we talked about all those different treatments for depression, anxiety, when we talked about all the medications like the SSRIs, right, the tricyclic antidepressants, etc. So that's using medicine, right, pharmacology, to treat a condition. The other thing I just want to point out is there's actually a bunch of different implants that can be put inside a patient that can also directly stimulate nerves to help. So some of the treatments they've done this for is they've used it for depression, they've used it for Parkinson's disease, they have a vagal nerve stimulator to help with epilepsy. And so I just threw this picture in. You can see where some of the different treatments are. Chronic pain is another one that they'll do. And it basically is a device that can send out an electrical current, which basically is like an action potential, and it can actually activate or inhibit certain nerves in the body. And then neuroplasticity is, we always think of our brain as being this static thing, but our brain is constantly changing. And every time we have a thought, we form a pathway, right? We have a synapse. And the more we have those thoughts, the more well-worn those synapses become. Well, what happens is sometimes we end up in these habitual thinking patterns, and they might not always be good. Like, I can never pass an anatomy test. That is not a good thought to have. One way to help you reframe your thoughts is maybe think, I'm having trouble with anatomy tests. Add the words not yet at the end of a sentence, but we end up forming these patterns of thinking that become very well ingrained in our brain. And neuroplasticity means that we can change the patterns. We can actually get rid of old thoughts and use new thoughts. So what happens is if you think about having a well-worn pattern that you're forming from thinking something over and over and over, it gets pretty strong, and that's your go-to. If they're not healthy, with repeated and direct attention, it's not easy, but you can actually form new pathways. You can change your thoughts. And this is the idea between mantras, having positive thoughts that you constantly inundate yourself with, and you can actually rewire your brain. Now, when we look at some of the different anesthetics, we're going to look at some more drugs and how they affect the synapse. And some of this we actually looked at when we looked at the neuromuscular junction, but we know we need anesthesia. For example, if you're having dental work, you might have lidocaine, or if you're having a major surgical procedure, you probably want to be put out, right? Put under general anesthesia. And very basically, what they do is that they block or they plug up that sodium channel. So remember that the first step for an action potential or nerve impulse formation was the opening of sodium channels. So if you can block those channels, there's no impulse conduction. So you won't be aware of the pain. Now, the neurotoxins are where we looked a little bit previously. So these are things that could be synthetic, they can be man-made, they can be naturally occurring. And these are things that basically are going to impair the functioning of the CNS or the PNS. So we talked about some of the toxins we'll look at again, but also a lot of heavy metals like lead and arsenic and mercury also are neurotoxins because they basically can kill neurons and interfere with conduction. So the first one that we looked at, I believe, was the TTX from the pufferfish. And this toxin is actually, you can see this big yellow thing. And what it does is it blocks the sodium channel. So it plugs it up like a cork. And so sodium cannot bind, therefore you will not be able to transmit nerve impulses. So at a neuromuscular junction, the muscle won't contract. You'll end up having weakness and numbness and paralysis, and then it would interfere with exciting neurons. Now, we've talked about botulism before and tetanus. So remember that the botulism toxin is one of the most deadliest toxins out there. And so when we look at the botulism toxin, it's going to basically stop the release of acetylcholine. So here's your little overview. Remember, acetylcholine is released. It diffuses across the gap. It binds to receptors. And when it binds to receptors, it basically stimulates, if it's in a muscle, right? It's going to open the sodium channels. Well, what happens with the toxin is it doesn't allow acetylcholine to be released. The other two affect acetylcholine esterase. And remember that acetylcholine esterase's job was to break down the acetylcholine so the muscle could relax. Well, remember that the Clostridium tetani does this, and now you know it inhibits GABA. GABA was an inhibitory neurotransmitter, so it blocks GABA, therefore you can't release acetylcholine esterase, therefore the muscle contractions keep going, so you have that rigidity and spasms. And then your organophosphates, which are shown in this red one, similar idea, what they're going to do is not allow, notice that they are going to bind to acetylcholine esterase, or ACHE, so it cannot break down acetylcholine. So this is the mechanism of sarin gas, by the way. Now, the other neurotoxins we talked about were some of those heavy metals. So mercury, lead, arsenic, they're all pretty bad. They actually can kill neurons. Mercury blocks protein synthesis. It alters the blood-brain barrier. We know that you see it's a major neurotoxin, and you have to be careful because a lot of our fish have become polluted with mercury from the oceans. So you have to be careful with that. And then just a note, when we talked about the drugs, methamphetamine actually can damage those dopamine neurons. So it affects dopamine and it can block those and cause damage to those as well. The demyelination is things that can remove that myelin sheath that is surrounding the axon. So one thing we know happens is MS, which is multiple sclerosis. You can see some information here. You have what are called autoantibodies. So the body, the immune system, makes antibodies against its own cells. In this case, it attacks that myelin sheath. So as that myelin sheath starts to basically disintegrate and be removed, it slows down the conduction of nerve impulses, and it can cause difficulty sending nerve impulses. With MS, it can go into remission, where there's times where it's better and times where it's worse. We also know that some of our heavy metals can do this. So arsenic can do this as well. It can cause this demyelination to occur. As far as the lead goes, that's also pretty bad. In fact, I realized I just skipped that on your handout. I apologize for that. But basically what lead does is we know it directly damages the brain. It delays brain development, and it directly damages our neurons and damages proteins. It can cause learning disabilities. That's why they have rules about lead-based paint, right? You don't want to eat that stuff. So these are all examples of metals and toxins that damage our nervous system. Now, I put seizure here because it's basically an electrical storm in the brain. That's how it's described. The neurons just kind of go crazy and start sending electrical information when they're not supposed to. There's an area in the brain called the thalamus that we haven't learned yet, but the thalamus kind of processes all information with the neurons, all sensory, and it tends to help synchronize between the activities. So the seizure often runs. The thalamus is kind of like the central housing part of it that allows it to go back and forth between the hemispheres. Now, seizures vary quite a bit. They can be staring. They can be very brief. They can look like you just kind of zone out. They can be abnormal movements, unusual sensations. Sometimes people have auras, inappropriate behavior. So my youngest has had epilepsy, and he's been seizure-free for 9 years now, which we are very, very blessed to be able to say. So I'm quite familiar with seizures and epilepsy. So if you have it, or anyone in your family does, please feel free to reach out to me. We actually were able to stop the seizures by eliminating wheat from his diet and artificial dyes. And my son was actually on 3 different meds. It was pretty bad. And he's seizure free, so it's pretty cool. As far as the seizure goes, just know that they're generally classified as generalized or partial. So depending on which area of the brain determines what's going to happen during the seizure. Now, you are not memorizing this. I just want you to get an idea as we study the brain that different areas with this electrical storm, with these neurons firing, are going to cause some specific signs and symptoms. And I had read a couple books on epilepsy, and what was really shocking to me was temporal lobe seizures. They say that deja vu feeling, which I've had quite a few times, they say that that's actually a small seizure. So, seizures are a lot more common than we realize, but you can see some of the things that you might see from a seizure. So general seizures affect both hemispheres. The whole brain is involved. The tonic-clonic were called the grand mal. These are the very scary ones. These are unfortunately the ones that my son had. He actually had both. But basically this is the one where the person goes suddenly very, very rigid. That's the tonic. All the muscles are basically contracting. And then the clonic are the convulsions. And so they can last several minutes. Unfortunately, typically the person's not breathing during that time. A petit mal, or it's called a focal seizure. This is characterized by staring. So you kind of like zone out for a little bit. This is what kids might have in school where they like miss time or they miss information. So these are focal seizures. A partial seizure is just in one area of the brain. So it's going to start in one specific area. Now these can spread too, but sometimes they're localized in one area of the brain. As far as why do people have seizures, there's a lot of it they just don't know. Idiopathic means we don't know, and that's what my sons were. Febrile seizures can happen from a fever. Head trauma could cause seizures, and tumors could also cause them. So, they're fairly common. If you look at the 1 in 26, most people have idiopathic. A third of them have treatment that doesn't even work. So you can look into diet. Like I said, we were on 3 different meds and he was still having breakthrough seizures. Unfortunately, there is something called SUDEP. It's sudden onset death of epileptic seizure, basically. What happens is when you have these major seizures, your brain isn't functioning normally, and a lot of times you stop breathing. And so what happens is in some people, small percent, they actually will stop breathing during the seizure, and it would be fatal, obviously. And then when someone's having a seizure as well, you could fall if you have a seizure in water, right? You could get drowned. So there's a lot of concerns with epilepsy. And so the treatment is the anti-seizure meds. And the scary thing with these meds is they don't know exactly how they work, but they're all going to, typically what they're going to do is try to raise GABA levels. Remember, that's my inhibitory neurotransmitter. And they try to lower glutamate. And so what happened with my son was we put him on a special diet that my husband actually found online that's used for pets. And you lower glutamate and you don't do any aspartame. And so it was no dairy, no wheat, and he did very well on it, and the seizure stopped, and now we've introduced dairy in smaller amounts, and he's still doing really well with that particular diet. So a lot of the meds are going to block the sodium channels or block the calcium channels to try to prevent that stimulus from basically running from one part of the brain to the other. The other thing that we've been doing is giving magnesium every day, and it was very helpful. I think that's also part of it. Magnesium is inhibitory. Now he has migraines with aura, so his neurologist now has actually said to take magnesium daily because they're finding that it helps decrease the incidence of migraines. And then just a quick thing, if someone's having a seizure, if you see one of these tonic-clonic seizures, they're scary. What do you do? What don't you do? You never hold them down. They're not going to bite their tongue off. You don't put anything in their mouth. You just basically put them on their side so that unfortunately, as they're seizing, they're not swallowing, so there's a buildup of saliva, and they'll need to get that out. Just keep them away from anything that could harm them. Usually time the seizure. If it's going on more than 5 minutes, you would call 911, and then you would just wait. And then once they come out of it, they are very, very tired. There's what's called a post-dictal phase. My son would sleep for hours after a seizure, and they're going to be a little bit out of it, so it's just trying to be reassuring to them. So this concludes the clinical lecture on our neural tissue.